Irritated from near Peterborough today. So I've just got off the phone after another lengthy conversation trying to undo something that I don't think should have ever been done. So this is not a political story today, although it kind of slightly might have a political connotation. We've got to get to the bottom of that. I need to do some journalism on that. But this is a customer care story. By the way, thank you to everyone that's subscribed. We're over 30,000. I'm absolutely thrilled. It's brilliant. I love each and every one of you, even the ones that write the same not so nice comments. Don't care. It's a platform. You write what you like. So the story. Oh, like and subscribe, by the way, if you haven't. Let's see how far we can go with this. So the story to date is my son needed to see a surgeon, a consultant, and have an MRI because he's got problems with his lower spine. He's had that for quite a long time. It's been causing him more and more pain. So we get into our local GP after about 5 weeks of trying to make an appointment. And the GP says, yeah, there's a problem. We've already been to see the physio and the physio has said, yeah, there's a problem. We think he's got a herniated disc or a bulging disc. We don't know. So both say we need an MRI. Okay, great. How do we do that? Well, GP says I'll have to refer you to the pain clinic first and then they will refer you for an MRI. Okay. It could be about 4 months before you get to the pain clinic. Not so okay. How long then from the MRI? Don't know. Could be up to 6 months. Okay. So nearly a year possibly we're looking at to, 4 months to get off the starting blocks and then 6 months forwards. Now, it's not the doctor's fault. This is what happens in the NHS. So my son, who's in a lot of pain, looks as though, well, you can imagine how you'd respond to that completely justifiably. So I say, look, my other half has private healthcare insurance. Do you think that would expedite this? Do you think we would be able to go down that route? And he said, yep, absolutely. You'll get seen much quicker. Now, for the record, I'm an NHS fan. I've had surgery on the NHS myself throughout my life. They've looked after me very well. They've looked after my children very well. They've looked after our whole family very well. We are big NHS fans. We absolutely see that the NHS, from the very fact that we had to wait as long as we did for our appointment and as long as we would have to for any treatment, the NHS is struggling. It's drowning. When Keir Starmer talks about waiting lists being reduced, that's not true, is it? This is the actual experience. So there's a little conflict because I know that I'm going to get what I need from the NHS, but I'm not going to get it in the time frame that I need and that my son needs. I also know that if we go down the healthcare route, the private healthcare route, then somebody who hasn't got private healthcare will take our place on the slot for the MRI. So hopefully they will get seen quicker as well. So that's the logic going on in my mind. So the GP writes a referral, and we go about finding a surgeon. Now, my son is 17, so that is very difficult. There are very few private consultants that will take a 17-year-old, and specifically in the spinal region. Now, bad luck for me and him, but I had to have surgery a couple of years ago on my spine. It's not my first surgery. And I had a particular consultant that the healthcare provider had endorsed. So I was like, okay, let's see if he takes 17-year-olds, and if so, we'll go there. I trust him. I trusted him with my spine. It worked well. So we phone up. Yes, he does take 17-year-olds. So brilliant. Okay, let's get the appointment in. So that was about a month ago. So we finally get the appointment in for the 1st of July. My son is obviously frustrated because it's still another 4-week wait and we've got to get an MRI and have the consultant appointment and then work out what we're going to do. But at least the ball's moving. At least we're on the journey. And I'm very, very grateful that we are in that position that we can do that. I do not take that for granted. And I am thankful. So it's all booked in. I get an email yesterday telling me that that appointment has been cancelled. And the reason that that appointment has been cancelled is because AXA Healthcare have deregistered this particular consultant and others that work at this particular hospital. And I'm gobsmacked. I'm floored. So I phone up the PA who sent the email and say, talk me through this. Is there any way around this? What can we do? And she said, no, as of today, everything has to be cancelled, surgeries included. They will honour anything up to 30 days. So if you'd got treatment or a surgery within the next 30 days, they will honour that. After that, you're done. I'm like, well, what if your surgery's booked in 6 weeks? No, it's gone. So what do we do? Where do we go with this? Because you're sort of one of 3 surgeons in the UK that will take my 17-year-old, and you're the one that I trust because you did the surgery on my back. It's a big thing. And she's like, I'm really sorry, you can either self-fund, which we can't afford to do, or find a different consultant, but there is nothing I can do. They will not authorise your request. And I say, I don't know, how can AXA do that? How can they say, on a day, that's it, you're done, you've got 30 days? In an industry that should pride itself on its ethics, on its compassion, its integrity, its empathy, there's an ethical framework in medicine. How can AXA just do this? And as a side note, but not a side note, I then find out last night that a friend's relative had their cancer treatment stopped in exactly the same way earlier on in the year. So it would appear this is not the first time. Now, the official reason is cost saving. So when I said there's not a political slant, there is a slight political slant, because we wonder why we're suddenly cost saving. And I don't know, I don't like assumptions, but the economy is not exactly going in an upward trajectory, is it? So anyway, we'll get to the bottom of that. But that's the reason, cost saving. So we're left in a complete quandary. So I phone AXA, and this is where the story takes a bit of a turn for the better, because whilst the powers that be that made this decision, made this policy and cancelled people's surgeries, treatments and appointments, with immediate effect, the lady who answered the phone does have compassion, empathy and integrity. And I'll be totally honest, I was in tears. I'm extremely worried about my son. It is horrible to see any member of your family in pain or be in pain. If anyone's ever suffered chronic pain, it's horrendous. So I'm frustrated, I'm emotional, and I'm worried. And I explain everything to the lady, and she's brilliant. She's really nice. She completely understands. She gets it. And she's quite shocked, to be honest with you. And she goes through her system and she goes, oh, yeah, I see. They have. That's exactly what they've done. So we have a conversation about what do I do now, because there's hardly any surgeons that will see a 17-year-old. And she says, look, I will try and find somebody. I will text you with the details of somebody that you can go to. And to her credit, I got a text today of somebody to ring to see if they could see us. So I did ring them and explained the whole situation to them and said, look, we were supposed to be coming in on the first week of July. Is there any way you can do the same? We need an MRI and a consultation, ideally on the same day, so that we can work on a plan straight away, because this has been going on for a long time now. And they have moved heaven and high earth to accommodate my son, and I am so grateful to them for doing that. But they should never have had to. They haven't impositioned anybody else. The surgeon in question is accommodating us as an extra, so that's amazing. It's staggering to me, however, that AXA Health have made this decision irrespective of what that's going to do to the patients and their outcomes. And whilst I can understand that we have to make cost cutting, I mean, everybody's cost cutting, aren't we? That's all anyone's ever doing. I get that. I get that sometimes things have to change, and I don't disagree with that. I know that actual difficult choices are being made, not the ones that Rachel Reeves and Keir Starmer and Bridget Phillipson talk about, but actual real life difficult decisions are being made. So if AXA does have to make cost cutting decisions, so be it. But would you do it instantly with immediate effect, or would you say, as of September the 1st, we will no longer be endorsing any healthcare with XYZ, and list the consultants that you won't use anymore? Any treatment up until that point, or any treatment scheduled in within that window for the following 6 months, will be honoured, but from September the 1st we will not be taking any more, and within 12 months there will be no more honouring of the existing surgeries and treatment plans. That gives people a chance to get themselves organised, to find somebody that they trust, to actually get in to somebody, and it gives the patients control of their own medical history and condition and outcome. And to take away the control of somebody who has a medical condition is, I think, quite violating. I think if you've ever had, anything that needs medical intervention, it's very worrying. It's very stressful. People don't get a date for an operation and go, yay, okay. I mean, they're obviously initially pleased because hopefully it's going to make them feel better, but they don't sort of like look forward to that date with glee as though you would a party. It's like, I'm nervous, I'm worried. There's a level of anxiety. It's not something that we go, ooh. So if you've been holding that anxiety and holding that fear to then be told that that's not happening, that's massive. Now, I know that happens on the NHS every single day, and it isn't right. It is wrong. Surgeries shouldn't be being cancelled, ever. I can't, there's no but, it's just wrong, full stop. And here we are paying for the surgery to be cancelled. You know, you pay a premium, or your companies pay a premium, and this is a company healthcare plan. So these companies pay an awful lot of money to the insurance providers for the service for their employees, and we're paying for stuff to be cancelled. So as I said, we've got a positive outcome. I mean, it still meant that I've had to inconvenience our local surgery because we have to now have a different referral letter, which requires different wording and different writing for the new surgeon. So I've had to go back to our local doctor's surgery and say, please, would you rewrite this? I'm so sorry. I know you've got better things to do with your time, but otherwise we can't get this treatment. And can you do it sort of like within the next 3 hours? Because we'll miss the appointment. And then if we haven't got that appointment, we are now looking at another 6 weeks. So if there's any way you can get this through, I'd be really grateful. I don't know whether we're going to hit that deadline. And again, that is something that we've got to work with. But the knock-on effect, and I always say to my kids, you know, every action you make and take has a consequence. It's like dominoes. And the domino effect has impacted more than just me and my son. So I'll keep you abreast of what's happening with this. If anybody else is going through this, share the story if you feel it will help and if you want to, and we can look into it some more. And I'm really sorry. I'm really sorry that this is happening. And I with every fibre in my body, I hear you. It is beyond. I had a big cry about it yesterday. I know I'm not the only one that would have responded like that. So yeah, I'll let you know. But that's why I put the inverted commas around AXA Health Care, because it feels like on that particular decision, there was absolutely no care.